Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zach Caseberg, your tutor, your coach, your guide along the path to passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know how to effectively pass the CDR exam. And if that sounds like you, then hey, you are in the right place. Thank you for everyone if you're listening live. We've taken a little short hiatus on doing our live sessions. So if you haven't seen those before on the RD Exam Ready YouTube channel, we've been doing some live YouTubes just to give people some more free content. Last week I took a little break on that to do some parenting, but we're going to have another one coming up here. So March 25th of 2026, if you're listening live, we're going to be having another RD Exam Ready live on YouTube. And for that session, we're going to be doing more practice questions. I want to remind you that if you do want to join the mailing list, the email list that is going to be located in the bio of this podcast, if you join that, you do get some of the PDFs and notes from those sessions after the fact. So if you haven't joined that yet, please do so you can get that in the future once we have those sessions. And make sure that you go ahead and join and subscribe. Look at me and all the social media stuff, anything RD Exam Ready on TikTok, Instagram, whatever it is, if you want to get more free content, questions, or more announcements. Now, when I say the word wound, what do you think of RD to be? Things may jump into your mind. It might be certain vitamins, certain minerals, macronutrients that you think of. You may think of the scar that's located on your arm when you fell when you were young, or you might think of that late stage pressure injury that you saw on a patient when you were doing your dietetic internship. All of these are correct associations for you to take as you learn about wounds. And today I want to solidify that information. I want to organize it, and I want to make sure that we have all of our bases covered when it comes to wound healing, and specifically the medical nutrition therapy behind wounds and the healing of wounds. Kind of to start out here, when it comes to wounds, really the first thing that should come to your mind is how severe of a wound we're talking here. The severity of that wound is going to dictate a lot of things along the healing process. Thinking of if it's a very severe wound, the patient's metabolic rate is going to be increased. Maybe you would think of how much protein, how much vitamins, how much minerals they would require, or thinking of the severity of that wound and how it would dictate the level in which we're going to be able to feed themselves, their quality of life, and kind of their long term level of pain and where that wound is located. All of these things would be considered in our assessment when we're using ADIME. And when it comes to wounds and pressure injuries, I want you to be nice and open to considering that. The reason I point these things out is because we know that obviously someone who has a very deep pressure injury or a full thickness injury or a severe burn, their metabolic rate is going to be much higher than that of someone who has a little scratch on their arm like I do right now. In general, a wound is a disruption of the normal structure and function of the skin in the underlying soft tissues of the skin. A chronic wound is typically a complex wound that is physiologically impaired and doesn't follow the typical stages of wound healing. The exact timeline of a chronic wound really varies, but let's say, just to give you some reference, maybe 4 to 12 weeks old would be what we would consider a chronic wound. In wounds and wound healing, it's a complex process that considers so many elements, and your nutrition status and different comorbidities are going to dictate that. Certain comorbidities like diabetes, autoimmune disease, peripheral artery disease, BMI, and even the medications you're on can dictate how quickly that wound is going to heal for your patient. Working in the acute care setting, we see lots of surgical wounds all the time. And with surgical wounds, in the context of good nutrition status, we would expect that patient to recover quite well, although we know that the reality is most of the time in the acute care setting, we're dealing with very sick people. So even a surgical wound can keep coming back and take a long period of time to heal, depending on that patient's health status. There is a healing process with a wound. The normal phases that a wound should go through would be these three phases: a inflammatory phase, followed by a proliferation phase, and then a remodeling phase. Before that inflammatory phase, we have this kind of hemostasis phase that occurs. And the whole goal of that hemostasis phase is just to get the wound to stop bleeding. So during this phase, blood starts to clot, clump together, and prevent that wound from continuing to release blood. After that is that inflammatory phase. Now we're seeing the blood vessels actually dilate, they open up a little bit, and they go through vasodilation so that we can get fresh blood, fresh nutrients, and fresh oxygen to that wound to start healing things up. We see this tissue kind of fill like a pool where the tissue starts to fill, and that's when we're starting to get into more of that proliferation phase. We get fibroblasts that are present to help build up that tissue around the wound, lay collagen into the wound. And then finally, when we get to the remodeling phase, we see the wound close up and we get a nice epidermis layer on top of it or a scar. Luckily enough for all of us, we're not going to have to always know each stage of wounds or identifying wounds, but I think it's good that you have some background on wounds themselves. We can have wounds that are in the vascular area, in your arteries, in veins, there can be wounds. There can be more neuropathic wounds that are caused by things like neuropathy from diabetes that are affecting the nerves of the body. We can have moisture associated dermatitis. You could have skin tears that would occur, and then different pressure injuries, of course, too. Wounds tend to have multiple etiologies, and there's wounds that are caused by the cardiovascular issues, like I talked about. But typically, what we're seeing in practice is more of those wounds that are caused by other chronic etiologies. For instance, I would say what we see most of the time as dietitians could be a patient with diabetes who has a wound on their foot that is not healing. And that would be more of a cause by a neurological or a diabetes related etiology. We also have injuries or pressure ulcers, which we especially see if you work with elderly populations, those with uh, TBIs, for instance. You may see a lot of pressure injuries because they do occur pretty often. Especially they occur in people who are not moving around, whether that's at home or in the hospital. If they're not getting enough movement, all of that extended pressure laying in a bed or from a medical device can cause that injury and that pressure injury. Now, I'm going to talk briefly about these, but today we're going to talk mostly about pressure injuries. Moisture associated skin damage, just to touch on this briefly, it's a very common inflammation of the skin, and it usually occurs in areas where moisture may get trapped in skin folds. This can happen to a patient with severe obesity. They have lots of skin folds that need to be cleaned, stay dry, but also like diaper rash. Whenever you see that little folds of a baby kind of near their legs and areas, you may open up those folds and you may see some redness, and that's usually caused by moisture related skin damage. These can be very serious. The skin does get damaged, but a lot of that damage tends to be superficial or on the surface. But what can result is if that epidermis, that top layer of the skin is damaged, eventually bacteria can penetrate under that surface and get in there and cause more issues. But usually it does seem like moisture related damages tend to just be on the surface. Probably our biggest concern is when we look at the pressure injuries because they tend to be so severe looking and commonly have lots of nutrition implications too. Pressure injuries result from localized damage to the skin and the underlying soft tissue, and this primarily occurs in bony prominences or related to medical devices. These injuries can lead to a significant reduction in patient quality of life. It can impose significant substantial costs on both patients, the healthcare system, and really increases the risk of morbidity and mortality, hence why they're such a concern. What a pressure injury is you're having force that's being pressed perpendicularly against something. So let's say my arm is resting on a bed or something like that. We have that perpendicular kind of pressure that's suppressing into my skin. The tissue is being compressed, my blood flow is being depressed. You get ischemia and necrosis of that skin and rupturing of the blood vessels, and this causes the tissue deformation. There's also kind of a shear force, and what we say shear is more like Scraping is what you can think of a little bit. So it's not just the pressure, it's also the fact that if my arm is hanging off the side of the bed, usually there's some shear force that's kind of pulling on my skin. And that's causing some distortion of the tissue itself when it's being pulled, distorted, and it can cause occlusions of the blood vessels perpendicular to that surface. And once again, that's just going to contribute to more ischemia and more necrosis of that skin area. I want to discuss today a bit of staging of pressure ulcers. So, we're going to give a few different recommendations and we'll map out what the MNT would be for each of those different stages. If you can stomach it, RDTB, I highly recommend looking up the great charts that are out there about staging of pressure injuries. It's really going to help bring the image into your head, literally, of what these stages are going to look like. So let's stage these out. Before we stage anything, let's talk about when we suspect a pressure injury. Is usually we suspect a pressure injury if we see some purplish or some maroon colored skin, like a blood filled blister that is damaging the underlying soft tissue due to pressure or shear. It might be painful, mushy, warm, or cool compared to other tissues. This is a suspected pressure injury, but we're unsure if we can actually stage anything at this point. And during this, usually the skin is still intact, but it's starting to show some signs. Stage one, now we're into pressure injuries. This is considered a partial thickness ulcer. It's where your skin is still intact. What we see is redness over a localized area, typically a bony prominence. And these areas might be painful, firm, soft, warm, or cool as compared to those other tissues. Usually, with a stage one pressure injury, it is important. It is getting to be bad, but it's not something that maybe would require as much nutrition implications as these later stages. Stage two is still continuing to be a partial pressure injury, so partial thickness ulcer. That means not everything is exposed. We'll see stage two as an actual loss of the dermis, so an actual loss of that layer is what you're actually seeing there. And although this is not considered a full thickness pressure injury, I do want to give you this image in your head. So let's say a really bad rug burn, or if you played baseball, softball, soccer, and you slid onto something. Maybe you didn't have pads on your legs, and what we get is this big scrape on that top layer of the skin, and it removes that top layer if you remember that. So what you kind of experience, it's not what you experienced was maybe not a pressure injury, but more of a shear injury, but that should give you a mental image of what stage two would look like when you have that total top of the skin just removed and filmed right off. So now it's shiny, it's bright, it hurts, but it's still not a full thickness injury. You're still just losing the top layer of the skin. Stage three is a full thickness ulcer, and that's where the cutoff really starts. In stage three, we may be able to see subcutaneous fat, but you would not see anything like bone, tendon, or muscle. None of that would be shown. Stage four continues to be a full thickness tissue loss, but now you're not just seeing fat, you're seeing exposed bone, tendon, and muscle. This is so bad right now. Kind of the final stage, or almost an intermediate stage, is what we call an unstageable ulcer. Now, this is still a full thickness ulcer with tissue loss, but the base of the ulcer is covered by this slough or this yellow tan, gray green kind of scabbish looking area. Basically, it's unstaged because we cannot see how thick it really goes. And so we call it unstaged because likely we can see bone, we can see joint, we can see tendon underneath there, but because it's so covered, we can't see anything. So really what they have to go in is they have to go in and cut that scab out, cut that area a little bit so you can actually stage and get some oxygen and blood flow to that area. So that would be an unstaged pressure ulcer in that case. When it comes to nutrition, we all know that adequate nutrition is required for skin health and for tissue regeneration. The literal building blocks that we use to build up our skin and tissue is coming from the nutrition that we all take in. And when it comes to that, we want to make sure we start with each of our macronutrients and our micronutrients and talk about how maybe each of these would fit into the different stages of wound healing. Macronutrients that we'll talk about today are especially energy, kcals, and protein are needed to maintain skin health and support tissue regeneration. Think of this as twofold. Firstly, the calories are going to be needed because the patient is going to have a higher metabolic rate and is going to have metabolic stress due to this injury that they're having. They're going through a healing process, so calories and energy are naturally required for that healing process. Additionally, you don't want someone with a pressure injury to develop malnutrition during the wound healing process because then we're just going to end up with more issues related to healing. So, we want to make sure we maintain their nutrition status, get them plenty of calories, and help prevent too much infection. For other macronutrients, protein is your major player. Proteins help provide collagen and the amino acids that are necessary to actually build up and remodel that tissue. So we really need a lot more protein here. The amino acid arginine has shown in some research to help enhance wound healing, enhance wound strength, and assist with collagen deposition. Glutamine is also considered as it's the preferred energy for enterocytes, lymphocytes, and macrophages, which are helping us to heal. In general, for protein, we'll come back to this, but we have high protein needs, somewhere between 1.5 to 2.0 grams per kilogram of protein, depending on staging. For micronutrients, we're going to start with our fat soluble here. Vitamin A is necessary in wound healing because vitamin A helps in protein synthesis, collagen formation, maintenance of the epithelium, and immune system modulation. In general, vitamin A is helping to stimulate that epidural removal and help assist with the collagen, I should say epidural remodeling, and help assist with collagen synthesis and scar formation. We also know that vitamin A is needed for various skin health conditions. So when you think vitamin A, think skin. Vitamin D is mentioned as playing a somewhat of a role in impacting the epidural layer, as well as vitamin D contributing greatly towards immune cell functions for someone that's going through healing. So we know it's essential, of course. Vitamin E is also thought of for a little bit of skin here, and it contributes to wound healing as it serves as an antioxidant, helping to influence the cellular signaling and gene expression to help modulate inflammation during the healing process. As I mentioned in the beginning, whenever we're kind of in that pre phase of right after surgery or right when the wound forms, we need to get some clotting going to help prevent that blood. Vitamin K is helping with this role here because vitamin K is essential to the coagulation cascade, which is helping to coagulate that area, stop the bleeding of that wound so that it has some involvement there. Vitamin K also has a little bit of involvement on the renewal of tissue and cell growth, which is essential for healing. Minor thing mentioned here, omega 3 and omega 6s may play a role in collagen formation in the reduction of inflammation. Now let's continue with other micronutrients more water soluble here. Vitamin C. That might be the big thing you thought of with wound healing. It's so essential during the healing phase because it's such a strong antioxidant. It helps with the synthesis of collagen, it enhances the activation of leukocytes and macrophages in wounds, improves tensile strength, and it also aids in iron absorption. Vitamin C is contributing to the synthesis and maturation and degradation of collagen, which is helping play a very key role when this patient is healing up. B vitamins have their own crucial role in wound healing, specifically towards proliferation and migration of the skin cells that are needed for tissue repair. All B vitamins are being used and being essential for the cellular metabolism and energy production that is needed in wound healing. So we want to make sure they're getting plenty of B vitamins here. For other micronutrients here, zinc is probably the biggest one that you ever think of when it comes to minerals. And that's because zinc is a cofactor for numerous enzymes involved in cell membrane repair, cell proliferation, and in immune system functions. It's essential for every stage of the wound healing process, which is so cool. And what we specifically know is that a zinc deficiency is going to delay wound healing, so we need to stay on that. Selenium plays a minor role in wound healing due to the fact that it is an antioxidant, it's anti inflammatory, and it's antimicrobial. It serves for several cofactors in the wound healing process and helps to assist in the formation of the necessary amino acids for wound healing. Magnesium should also be considered as it also influences several cellular processes in the promotion of tissue repair. And finally, iron. As you're losing blood and requiring more blood for wound healing, iron is going to come into play. Iron is, of course, helping to transport the oxygen to the cells as a component of hemoglobin, also helping with collagen formation and creating energy from cells. For those of you that are working or have worked in the clinical field, you may know about Juven. Juven is a very common supplement that is used in clinical practice. And to help you with your memorization here, Juven contains vitamin C, arginine, glutamine, collagen, zinc, vitamin C, vitamin E, and B12. You don't need to know Juven for the exam, but if it helps you to know those vitamins and minerals, then that's perfect there. So, after everything, folks, we do need to take this nutrition information and know how to apply it for MNT. What we're going to do is review over each of these different pressure injuries and talk about the different MNT recommendations per the Krauss manual that they would give. For a suspected deep tissue injury, the manual recommends 30 kcals per kilogram of body weight. You may say, Zach, that doesn't sound like much for as far as calories go. And you're right, it's only a very slight elevation in calorie needs to help promote the skin and wound healing. For protein recommendations, it didn't say anything about protein other than for normal healthy adults to get zero point 0.8 grams per kilogram, and for elderly, for them to get 1 gram per kilogram. So, really just normal protein needs for that suspected injury. Once we elevate to a stage 1 pressure ulcer, we see energy needs change. They're going to be between 30 to 35 kcals per kilogram. We also see the protein jump here too. 1.25 to 1.5 grams per kilogram of body weight for protein is recommended. Fluid is also going to be recommended for all these stages too. 30 milliliters per kilogram of body weight for fluid will help to meet their needs and make sure it keeps that area nice and moist and gets them all that they need. A stage 2 pressure injury, we're still in that partial thickness, and nutrition is important, but it's not going to get so severe here. Nutritionic recommendations for stage 2 are exactly the same almost. So 30 to 35 kcals per kilogram of body weight, 1.25 to 1.5 grams per kilogram of body weight, and fluid needs of 30 mils per kilogram of body weight. In the Krauss manual, nothing is mentioned up to this point for supplementation yet. Of course, the supplement is not going to hurt them by any means, but it hasn't really triggered the supplementation yet for this injury. Once we're in full thickness, stage 3, we start to see that to change. For a stage 3 pressure injury, calorie needs are jumping up 35 to 40 kcals per kilogram of body weight. Protein needs are also going to increase by 0.25 across the range. So protein needs are then up to 1.5 to 1.75 grams per kilogram, and I would call this moderate to very high protein. This patient would still require a high amount of fluid, about 30 to 35 milliliters per kilogram of body weight. And finally, the manual recommended a multivitamin with 15 milligrams per day of zinc. So, as a multivitamin, it's probably going to already include your B vitamins, fat soluble vitamins, vitamin C, but not all of them have zinc. So, that's why in particular it was mentioned. So, 15 milligrams per day right there. For the stage 4 pressure injury, we see very similar to needs as that of stage 3. 35 to 40 kcals per kilogram. Protein needs jump once again by 0.25, so now protein needs are 1.75 to 2 grams per kilogram of protein, and the fluid needs stay the same. 30 to 35 milliliters per kilogram are going to be required. They also recommended continuing with a multivitamin supplement, one that is going to have at least 15 milligrams of zinc per day, if not more. For your unstageable pressure injury, folks, especially if you think it's going to be quite severe, we would want to remove that necrotic tissue and then kind of recommend we stage it. But the nutrition recommendations were based on a stage 4 pressure injury anyway, even for the unstaged, because the unstaged is probably going to be still be very severe once you remove all that dead tissue. So it just recommended sticking with stage 4 recommendations. Now let's apply this to some practice questions. Number 1, provide blank kcals per kilogram of body weight for adults with a pressure injury who are malnourished or at risk for malnutrition. Answer A, 15 to 20 kcals per kilogram. B, 20 to 25 kcals per kilogram. C, 30 to 35 kcals per kilogram. Or D, 50 to 60 kcals per kilogram. Number 1, provide blank kcals per kilogram of body weight for adults with a pressure injury who are malnourished or at risk for malnutrition. A was 15 to 20, B was 20 to 25, C was 30 to 35, and D was going to be 50 to about 55 kcals per kilogram there. So based on this, let's use process of elimination. They have a pressure injury, they are malnourished or at risk for malnutrition. To me, based on what we just talked about, A and B, I'm going to rule out. 15 to 20 kcals per kilogram feels much too low for someone who is malnourished with a pressure injury. And the same would go for B. 20 to 25 kcals per kilogram just feels too low. Answer C was 30 to 35 kcals per kilogram. And I feel like this is my best answer because D, if D is 50 to 55 kcals per kilogram, wow, that's really high. We don't want to overfeed someone, and rarely do I ever see someone need 50 kcals per kilogram. So if I'm a little questionable on D and feel better about C, my best answer for number 1 would be to provide 30 to 35 kcals per kilogram of of body weight for adults with a pressure injury who are malnourished or at risk for malnutrition. Number 2, a patient with a stage 4 pressure injury would be best to supplement which of the following? A, zinc, omega 6, and potassium. B, zinc, vitamin C, and iron. C, vitamin D, vitamin A, and copper. Or D, iron, copper, and sodium. Number 2, a patient with a stage 4 pressure injury would be best to supplement which of the following? A, zinc, omega 6, and potassium. B, zinc, vitamin C, and iron. C, vitamin D, vitamin A, and copper. Or D, iron, copper, and sodium. Let's use our process for this. For A, zinc, omega 6, and potassium. To me, this feels off. I think the zinc is good, the omega 6, maybe, but the potassium doesn't seem to fit too well for me. And I would rule out answer A because I think we have better fits in these answers. B, zinc, vitamin C, and iron. I'm going to put a little check mark by this one. I feel that these three would be very essential and very important when it comes to wound healing, especially that zinc and vitamin C, as I always know those are going to be my triggers. C, vitamin D, vitamin A, and copper. Well, I do think these would be important, but if I have B as a better answer, B is much better options, and I'm looking for the best thing to supplement. So I would rule out answer C because vitamin D, vitamin A, and copper still all important, but it's not my best option. And D, iron, copper, and sodium. I'm going to rule this out because I don't remember us talking about sodium at all, and I don't think it's a good fit. So, for a patient with a stage 4 pressure injury, they would be best to supplement zinc, vitamin C, and iron for answer B. Number 3, a patient with CKD and a full thickness pressure injury would be contraindicated from consuming too much what? A patient with CKD and a full thickness pressure injury would be contraindicated from consuming too much what? A, carbohydrates. B, iron. C, fluid. Or D, vitamin D. For A, carbohydrates. Well, they have CKD, full thickness pressure injury. We didn't really say anything about diabetes here, so I'm going to rule out answer A. Carbohydrates doesn't seem like it'd be a good fit. For B, Iron. And remember, folks, contraindicated, that means we would not want them to consume too much. Okay. Contra, negative. Okay. Iron for answer B. I don't think this would be a good fit either because I don't think it would be much of a concern for too much. I think it'd be a concern for too little. C, fluid. Now, I think this would be a good answer because we know with CKD, obviously, too much fluid is going to make their kidneys a little worse. So I would hold on to C for right now. And D, would they be contraindicated from consuming too much vitamin D? I don't think so. I think vitamin D would be okay for the patient with CKD and a full thickness pressure injury. So I ruled out answers A, B, and D. And my best answer for a patient with CKD and full thickness injury, I would want to make sure that they don't consume too much fluid. So that's what we would watch for number 3. That wraps up today's lesson, students. I hope you watched, listened, and learned during today's show. Remember that passing this exam is a journey. We all need assistance along the way. Do me a favor, hit the subscribe button, rate, review, comment, let me know what you like or dislike about the podcast. I promise I can handle it. And as always, happy studying to you, RD to be.